Hello everyone, welcome you all with the Research Proposal Development YouTube video series. Today we are going to discuss Introduction to Nursing Research Part 1. Before we learn research methods, statistics, sampling, or data analysis, we must first understand the basic meaning of research. In nursing, research is very important because nursing is not just a caring profession. It is also a scientific and evidence-based profession. In the past, many nursing practices were based mainly on tradition or experience. But today, nurses are expected to provide care based on best available evidence. That evidence comes from research. For an example, when we teach a diabetic patient about food care, when we educate the mothers about breastfeeding, or when we prevent pressure ulcers in bedridden patients, we should use methods that are supported by research evidence. So, this lecture will help you to understand what research means, what scientific research means, what nursing research means, and why that we all needed to be consider about the research in nursing practice. As the learning objectives, at the end of this session, you should be able to achieve three main learning objectives. First, you should be able to define research and scientific research. This means you should clearly understand that research is not just searching information online. Research is a planned and systematic process. Second, you should be able to explain nursing research. Nursing research is research that focuses on issues important to nursing practice, nursing education, nursing administration, and patient care. Third, you should understand how research supports nursing practice. Research helps nurses make better decisions, improve quality of care, reduce errors, and promote patient safety. For an example, if research shows that hand hygiene education improves compliance among nurses, hospitals can use that evidence to design better infection control programs. In here, you can see that I attached a Google Form link for the pre and post test because I want to assess your prior knowledge before I'm going to conduct this session. Therefore, I would like to kindly request from you all to go with the description and find this link and please provide your honest answers with this pre-assessment. And after the lesson, I would like to kindly invite you all to go with the same link and try with the same questions and provide your post answers for that particular link. And then we can see what kind of improvement is in there with this conducted session. First, we are going to look about what is research. Research beings when we have a question, a problem, or something we do not fully understand. Research helps us move from uncertainty to better understanding. In simple words, research is a systematic search for knowledge. It is not a random thing. It follows clear steps. In nursing research may begin with a practical problem. So you can see that here is a statement from the Albert Einstein. I think you all are much familiar about the Einstein. So he's asking that if we knew what it was we were doing, it would not be called research, would it? So we have to find the answer for that. What is research? Is it search again? Some students think the meaning of the research is searching again, but in academically, research does not simply mean searching again. This derived from the old French and Latin words, and that's mainly focusing that the researcher, which means to seek out carefully or search closely. This means research is a careful, deep, and organized investigation. It is different from simply searching on Google or reading a textbook. For an example, if you read an article about pressure ulcer prevention, that is learning. But if you conduct a study to assess nurses' knowledge and practices on pressure ulcer prevention, it is research. Why do research? We do research for several important reasons. First, research helps us understand the world. In nursing, this means understanding patients, families, communities, diseases, health behaviors, and healthcare systems. In next, research helps us solve new problems. For an example, during a new disease outbreak, nurses and healthcare professionals need research evidence to understand transmission, prevention, and management. In third, research helps us improve existing solutions. Sometimes we already have a nursing intervention, but we need to know whether it is effective or whether it can be improved. For an example, when we are going to conduct a patient education, it is commonly used in nursing, but research can show which method is more effective. Is that a leaflet education? Is that individual counseling? Or is that a group's teaching? Likewise. According to the Creswell, research is a process of steps used to collect and analyze information to increase our understanding of a topic or issue. This definition is very important because it shows that research has three main parts. First, research is a process of steps. It follows an organized sequence. Second, research involves collecting and analyzing information. Collecting data alone is not enough. Data must be analyzed to produce a meaning. Third, research helps to increase understanding. The final purpose of research is not just to collect data, but to generate useful knowledge. For an example, if we collect data about nursing students' stress, we should analyze it and understand whether stress is mild, moderate, or severe, and what factors are associated with it. So, the research is not the same as reading books, reading journal articles, watching news, reading reports, listening to lectures, searching online. All these activities are useful for learning, but they are not research by themselves. Research means creating or developing knowledge through systematic data collection and analysis. So, the reading about the hand hygiene is not a research, but conducting a study to assess hand hygiene compliance among nurses in surgical ward is a research. Up to now, we are having a thorough idea about what is research definition means. When we are go in depth, so we can see the research is the systematic process of collecting and logically analyzing data for a specific purpose. The word systematic means the researcher follows organized steps. The researcher does not collect data in randomly. The phrase logically analyzing data means the researcher studies the data carefully and interprets it in a meaningful way. Every research study should also have a clear purpose. Without a purpose, data collection has no direction. For an example, if we want to assess knowledge regarding prevention of childhood diarrhea among mothers, our purpose may be to identify knowledge gap and plan health education